What is the link between nutrition and HIV/AIDS? Let me tell you. The human immunodeficiency virus, HIV, was transmitted from primates to humans approximately 100 years ago. In the 1980s, the virus was first identified to cause the acquired immune deficiency syndrome, or AIDS. By then, AIDS already swiped over Asia and Africa, killing millions of young adults and children, most commonly from infections that come along with AIDS, such as diarrhea, measles, pneumonia, or tuberculosis. So far, the disease is estimated to have killed at least 34 million people worldwide. Since its discovery, extraordinary effort has been made to treat and cure AIDS. The antiretroviral treatment has substantially increased the duration of disease-free survival, but up till now there is no cure for AIDS. In the year 2014, almost 26 million people were still living with HIV/AIDS, and only 40% of them were receiving treatment, leaving most cases untreated. The largest disease burden, 70%, is in sub-Saharan Africa. What does all this have to do with nutrition, you may ask? Well, HIV is also called wasting disease. The virus slowly depletes the body from muscle tissue and from important nutrients. HIV increases the basal metabolic rate, thereby increasing nutrient losses via urine, feces, expired air, and skin. Many patients also experience loss of appetite, and mouth sores can make food ingestion very painful. Nutrient absorption is reduced because of damage to the gastrointestinal tract and increased gut motility. Yet micronutrients are highly required in order to mobilize the immune system. It has been shown that deficiencies of vitamin A and zinc are associated with faster disease progression and also with mortality. Transmission of the disease is more likely, for instance, in the case of mother-to-child transmission. Therefore, a good nutritional status seems to be very important for better disease prognosis. Indeed, various studies have shown that provision of multi-micronutrient supplements to patients can help to support the immune system, to decrease the disease burden, and to increase survival. And studies in HIV-infected children have shown that micronutrient supplements, especially zinc, reduce the susceptibility and also the severity of comorbidities such as diarrhea, tuberculosis, and pneumonia. Usually a daily dose of the reference nutrient intake of each nutrient is recommended to be given to patients, but in fact the requirements are not exactly known. One study showed that a double dose of the RNI can have adverse effects. So a good nutritional status is very essential for people living with HIV/AIDS. It reduces the susceptibility to the disease and it gives infected people a better quality of life. In one of our research projects here at Wageningen University, we work on the development of a food supplement that can support the nutritional needs of this specific population group.